I want to talk for just a minute about how you actually tell the patient and family about the diagnosis. Some of the questions that you might get in response to your saying, I do believe this is Alzheimer's disease, and how you might go about talking to patients and families about those questions. So one question I often get is that a patient or a family member might say, well, we've heard that you can't really make a diagnosis of Alzheimer's disease. And so are you really sure that that's what this is? So it's a great question and gives me the opportunity to discuss with the patient and family the fact that it is true. We cannot be 100% certain about the Alzheimer's diagnosis unless there was a piece of tissue, so a biopsy, taken. In general, of course, we don't do those kinds of diagnostic tests in life. And so that's not part of the diagnostic process that we follow. However, I do think you can be confident telling patients and families that you've followed an evidence-based approach, and when doing that, there's evidence from the literature that you can get very high diagnostic accuracy. And fortunately, through this video series, we've talked about some of the most important differential diagnoses that you really don't want to miss as far as the reversible causes. So I do feel that you can feel confident that you can tell the patient and family that it is true. No one can be 100% certain, but you've followed the appropriate steps in making sure there aren't other conditions that could be contributing to the symptoms that the patient's having, and that you're quite certain about the diagnosis. If there's any uncertainty, and you can tell that the family's still uncertain, I generally welcome getting second opinions. I learn from them myself, having other specialists take a look at the situation and giving me advice for the patient and family. So certainly encourage you to be open to that. The other thing that can sometimes help too is this is where a referral to the Alzheimer's Association can be particularly helpful. Certainly they're not making the diagnosis, but what they're doing is they're supporting the patient and caregiver through the process of understanding what they're facing. And everyone comes to understand things differently, everyone learns differently, and the Alzheimer's Association has a wonderful array of printed resources, people that you can talk to one-on-one, because some of us do much better if we're hearing from someone with information. There's video presentations, etc. So if you have a family where that is an element that you think they could benefit from, feel free to make that referral right hand in hand with your giving the diagnosis. That can be a critical time to get patients and families well connected. Another reason this is a great time to give patients and caregivers information about the Alzheimer's Association is because, let's face it, you've given them a pretty staggering diagnosis. And I know lots of patients and families who leave the office and then come up with all their questions. Well, one of the wonderful resources that the Alzheimer's Association has is their 24-hour helpline. And that will give your caregivers and patients a wonderful resource to access whenever questions come up, whether it's an hour after they leave your office or 2 years later. It's a terrific way for them to get really knowledgeable resources and information right when they need it.